Hello everyone, my name is Candace Hinkston and I am the host for this Health Informatics Talk on college depression, a stakeholder discussion on the role of race and ethnicity in students' mental health. Today I'll be introducing a brief overview of the topic of depression, followed by data sources I have analyzed, an infographic presentation of these data sources, the identification of stakeholders, the importance of mental health in the college population, and how we can disseminate this information to college students and among stakeholders. Let's begin with the question, what is depression? According to the American Psychiatric Association, depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Sometimes called major depressive disorder, depression can affect both mental and physical health, creating problems that affect the function of daily life. Understanding the distinction between depression and sadness or grief is important for oneself and for helping others who are struggling to cope. It's approximated that 1 in 6 people will experience depression at some point in their lives, while almost every person encounters a period of sadness or grief during difficult times. The tables here show a few of the differences that can help us determine if we or someone we know is experiencing one of these issues. For depression, sadness, changes in appetite, irregular sleeping patterns, fatigue, negative feelings and thoughts are some of the most common symptoms of the disorder. For someone to be diagnosed with the disorder, it must typically last more than 2 weeks. When dealing with sadness and grief, the symptoms are similar to depression, but have several key differences. Typically, sadness and grief do not change one's self-esteem. Additionally, the change in feelings from sad to positive thoughts comes in waves as the problem is short-term compared to depression. However, depending on the type and perceived severity of the event that caused sadness and grief, it can lead to depression if left untreated. Depression is one of the most misunderstood mental illnesses by the general public and very complex in terms of physiological changes that occur within the body. This has led to many common misconceptions or myths about the disorder. Here you can see some of the most prevalent thoughts about depression. Depression only affects women. This statement is doing a great disservice to the millions of men experiencing depression and fearing the loss of their manhood by talking about their feelings and seeking help. Depression is all in your head. In fact, depression is a very complex disorder involving interwoven psychological, social, and biological factors. Everyone experiences depression in the same way. The complexity of factors that create major depressive disorder are factors that determine the cognitive and hormonal changes that a person undergoes when depressed, making the disease different for everyone. Also, compounded mental health disorders affect the experience of depression and treatment. Antidepressants always cure depression. Again, due to the complexities and varying degrees of severity of the disorder, other interventions may be necessary for different individuals. Overall, it's important to understand how these misconceptions can detract from an individual's likelihood of seeking help or from us being able to recognize the need for help in a friend, peer, student, or family member. This quote by Stephen Fry states, "If you know someone who is depressed, please resolve never to ask them why. Depression isn't a straightforward response to a bad situation. Depression just is, like the weather." This quote goes back to the misconception that everyone experiences depression in the same way. We should always keep in mind that there are ways to help without being invasive and causing more harm than good. Now I'd like to get into the data sources that I used for the infographic. The National Survey on Drug Use and Health, or NASDA as I'll call it, is collected to understand the impact of substance abuse and mental health disorders on the general population. To aid in research, prevention, intervention, and policy efforts, data collection for substance abuse and mental health data is collected to improve accessibility. From adolescent to adult populations, this data set is used to determine effective interventions to reduce disease burdens and abuse impacts to improve behavioral health in America. The NASDA data set is clear and convenient as far as interpretation, classification, storage, retrieval, and updates. The dataset lists each variable by topic and allows cross-tabulations and logistic regression on any chosen variable without the need for a statistical software package. The selected metropolitan micropolitan area risk trend, or SMART data, is collected to assess the health risk factors of United States metropolitan and micropolitan areas. This dataset was designed to provide localized health information for the identification of resources and appropriate allocation of resources to the most prevalent population healthcare needs in communities. The dataset is both current and timely. It's updated yearly to present the most accurate data across the United States and can be downloaded in several formats and represent a wide range of variables. Both datasets were collected by the Department of Health and Human Services, and I've compiled an infographic from these datasets which explains the role of depression both nationally and in the state of Texas for college students. So here's a representation of the infographic, but it's small as you can see. So I'm going to show it in sections. I've divided it up into 4 different sections. In this infographic, College and Depression, the Race Ethnicity Factor for the United States and Texas, we start off with NASDA statistics, evaluating the prevalence of lifetime major depressive episodes and past year major depressive episodes of full-time college students. As you can see from the 2 graphs, 34 million college students have experienced lifetime depressive episodes, and 18 million experienced episodes in 2017. The color wheel shows a similarity in prevalence by race that is continual. This is an indication that the proportion of individuals by race and ethnicity who have had issues in the past are still experiencing them, as well as new college students at the same rate. In the next section, still the national data from NASDA, we can see that treatment for past year episodes was at least 64% of the time treated by medication. Additionally, nearly every student who reported a major depressive episode said it created a work, social, or close relationship impairment. Of students who sought guidance, the majority saw a medical professional categorized as a doctor, followed by a psychologist, counselor, and finally a religious advisor. The graph below shows how requests for help are divided by race and ethnicity. As you can see, the chosen methods of guidance or help sought by students varied based on this variable. If we take a look at the next section, which incorporates data from the SMART dataset, isolated to the state of Texas, we can see some of the potential reasons for the type of help students chose and how geographical location affects students. For this comparison, the prevalence of mental health problems has been shown along with the rate of health insurance coverage in a rank from 1 to 8. For mental health problems, Hawaiian natives and Pacific Islanders have the highest rate of mental health issues, but have the lowest rate of health insurance coverage. Blacks have the lowest rate of reported mental health problems, while Native Americans and Alaskan Natives have the highest rate of insurance coverage. For the 9 metro areas surveilled, we can see that college students in College Station, Austin Round Rock, and Dallas Plano Irving have the highest rates of health insurance coverage, with the lowest rates falling to San Antonio, New Braunfels, and Fort Worth, Arlington. The most unsettling data, I believe here, is the unknown category, which represents those who do not know if they have insurance coverage at all. So why was Texas chosen as a place of intervention for college students in depression? If we look at the last section, as you may know, Texas has the most colleges of any state in the U.S. with approximately 1.5 million enrollees at any given time. This includes 45 public universities, 65 nonprofit private schools, and 254 for-profit private schools. This is an issue that Texas needs to address now, and there are simple ways stakeholders such as yourselves can help. First, providing healthcare insurance to all students regardless of income. There should be no health disparity among students paying thousands of dollars each year to attend an institution. And remember, depression can cause physical health problems as well. Second, offering a variety of free mental health services for students. As we saw, the types of help chosen by different races and ethnicities of students is ranging. Therefore, services should also be ranging. And finally, understanding the impact of race and ethnicity on mental health problems of students in order to tailor those services. To accomplish this, we need to identify the stakeholders for college depression so that collaborations can ensure the success of every student. Who are people invested in student advocacy and success? Well, the Centers for Disease Control and Prevention describe the typical stakeholders in public health interventions this way. Stakeholders are people or organizations invested in the program, interested in the results of the evaluation, and/or with a stake in what will be done with the results of the evaluation. Using that definition, I have created this influence diagram to show the stakeholders and their respective roles in the recognition, resource identification, and treatment of students struggling with depression. In direct relation from the student is the student support system, such as family and friends, or primary support, as I have it labeled. School counselors who provide guidance and referrals, student government and university administrators who assist with policy support, and educators, housing facilitators, and campus organizations who provide additional support. Outlying stakeholders include community organizations who are collaborators with primary and additional student supports, as well as financial aid providers who provide information on enrollment rates and other relevant demographics of students. With the effort of all of these collaborations and supports, information dissemination can be divided into three main areas of focus. First is a proposed online student orientation module that is required for both new and returning students at the beginning of each year. This would help promote mental health awareness and school and community resources. The module could be a prerequisite for enrollment in classes to assure each student is reached in some capacity. Next is the technical support of the university website direct links and mental health promotion. This will be an easily identifiable button or link that is available on the main welcome page. Promotion of all mental health resources as well as emergency help should be listed. A paper version of resources should be posted in each university building, similar to the infographic shown previously, so that even the most remote areas of campus are covered. And finally, the recommendation of a stakeholder toolbox of resources should be readily accessible with information to all faculty and administration so that you're never left unable to provide help for students in need or disseminate information on your own. Think of it like a crash cart for hospital staff. It would ideally be the first part of a process to initiate support and services for a student in need. Resource contacts, depression handouts, and strategies for coping are some of the necessary items for this toolbox. It's up to each of us to take our place as advocates for students to promote mental health and understand that the importance is a direct determinant of overall health and well-being. Student, university, community, and economic success depends on it. Here are a list of references used in this presentation for your convenience. And please contact me with any questions or comments. Thank you for watching.